my background, I have a PhD in molecular biology, biochemistry, and most of my prior career history has been in the development of genetic tests with respect to different diseases and different indications. I am now a medical director at Regeneron, and I am involved in clinical development, so primarily in drug development. But at Regeneron, we have recently initiated an effort to dovetail the exploration of genetics with drug development, and in some way this work that is presented today reflects our desire to gain a better understanding of the connection between genetics and disease.
You presented some very interesting material here at the conference. Tell us about that presentation.
Sure. So there's been a fair amount of investigation specifically related to age-related macular degeneration, or AMD, and the genetic association. And it's somewhat of an unusual disease in that it's a complex disease. There are different things that can influence patients' likelihood of getting it. In the environment, if one smokes, one's genetic predisposition, other factors including nutritional behaviors can influence one's susceptibility. So what we were looking at was, can we have a better understanding of the genetics associated with that component? How much does genetics influence one's disease? And so much of the work that's been done to date with respect to genetics have looked at a certain type of change in the DNA, and what we were looking for is a different type of variation to better understand how that might impact disease. Well, I think probably at this stage, this is really a way in which we can ask the question, do we know everything associated with the genetics of AMD? And I think really the findings are suggestive that maybe there's more to the picture than meets the eye. And I think that really suggests that additional investigation into this area might inform us to come up with a better understanding of disease, pathology, and potentially new drugs.
So as we start to classify and typify the various genetic profiles, do you see this aiding to the era of so-called personalized medicine, where we will have particular approaches that are best suited to certain genetic types?
And I think that's our goal, which is, I think historically there's always been the desire to provide medication to all patients, but certainly there are different patients that respond differently, some more favorably than others, and I think by having more information, one piece of it being genetics, potentially we might have the opportunity down the road to be able to provide the right therapy to the right patient.
What are your immediate next steps with this particular line of research?
Sure. So the data that we generated in the poster was from a trial that was run in the U.S. by Regeneron, and there is a sort of a sister trial, if you will, that was run outside the U.S., and we are looking to see if we can replicate these results in those samples as well.
Thank you very much for sharing this with us, and we'll follow your progress, and we hope to speak to you next year at AA.
Very good. Thank you.